Question 1. A client with acute renal failure is placed on continuous renal replacement therapy, CRRT. Which of the following is the most important nursing intervention to prevent complications? Option A. Closely monitor fluid balance. Option B. Administer anticoagulants. Option C. Assess for bleeding. Option D. Maintain adequate blood flow. The correct answer is option D. Question 2. What is the recommended strategy for preventing pressure injuries in a critically ill patient? Option A. Turning and repositioning. Option B. Use of specialty mattresses. Option C. Skin assessment and moisture management. Option D. All of the above. The correct answer is option D. Question 3. A patient with a history of end-stage renal disease, ESRD, on hemodialysis presents with a fever, hypotension, and altered mental status. The nurse suspects which of the following complications? Option A. Hyperkalemia. Option B. Uremic encephalopathy. Option C. Dialysis disequilibrium syndrome. Option D. Hemodialysis-associated hypotension. The correct answer is option C. Question 4. A patient with a history of hypertension and type 2 diabetes mellitus is admitted with new-onset atrial fibrillation. The physician orders amiodarone and apixaban, Eliquis, for the patient. Which of the following is the most important nursing consideration? Option A. Monitoring the patient's thyroid function. Option B. Assessing for signs of bleeding. Option C. Checking the patient's serum potassium level. Option D. Educating the patient on the importance of medication adherence. The correct answer is option B. Question 5. A patient with a history of traumatic brain injury, TBI, develops a fever and altered mental status. Which of the following is the most likely cause of the fever? Option A. Urinary tract infection. Option B. Ventilator-associated pneumonia. Option C. Central nervous system infection. Option D. Sepsis of unknown source. The correct answer is option C. Question 6. A 50-year-old patient with a history of congestive heart failure presents with shortness of breath, edema, and fatigue. Arterial blood gas, ABG, analysis shows the following: pH, 7.46 PaCO 2:30 mmHg Po 2:85 mmHg HCO3, 22 milliequivalent/L. What is the most likely diagnosis? Option A. Metabolic acidosis. Option B. Respiratory acidosis. Option C. Metabolic alkalosis. Option D. Respiratory alkalosis. The correct answer is option D. Question 7. A patient with acute respiratory distress syndrome, ARDS, is receiving mechanical ventilation. The physician orders neuromuscular blocking agents, NMBAs, for the patient. Which of the following is the most appropriate nursing intervention? Option A. Perform daily spontaneous breathing trials to assess for extubation readiness. Option B. Administer scheduled sedation to maintain the patient's Richmond Agitation Sedation Scale, RASS, at -4 to -5. Option C. Ensure the patient receives physical therapy and early mobilization while on NMBAs. Option D. Monitor the patient's train of 4, TOF, ratio to assess the depth of neuromuscular blockade. The correct answer is option D. Question 8. A patient with a history of chronic obstructive pulmonary disease, COPD, and cor pulmonale is admitted with an acute exacerbation. Which of the following is the most appropriate initial management? Option A. Administer high-flow oxygen therapy. Option B. Initiate non-invasive ventilation, NIV. Option C. Perform emergency intubation. Option D. Administer diuretic therapy. The correct answer is option B. Question 9. Which of the following is the most appropriate initial antibiotic regimen for a patient with severe sepsis? Option A. ceftriaxone. Option B. vancomycin. Option C. Broad-spectrum antibiotic combination. Option D. Targeted antibiotic based on culture results. The correct answer is option C. Question 10. A 55-year-old patient with a history of chronic heart failure is admitted to the ICU with acute decompensation. The patient presents with severe dyspnea, pulmonary edema, and hypotension. What is the most appropriate initial management? Option A. Diuretic therapy. Option B. Vasodilator therapy. Option C. Inotropic support. Option D. All of the above. The correct answer is option D.